Hi, I'm Polly Dawkins, Executive Director of the Davis-Phinney Foundation, and welcome to the first half of the first session of our free Care Partner Training program. The second half will be released soon, and you can access the full 10-part series on our website via the link in the description below. We're sharing these videos with you here as we develop new content for the program, and we invite you to sign up today to stay prepared for what's coming up. We know that supporting a loved one with Parkinson's can be really challenging, but the Davis-Phinney Foundation is here to help. We hope that you find value in this video and encourage you to explore our complete resources to help you live well as a care partner today. Hello, everybody, and welcome to the first session of our Care Partner Training Program. I'm Polly Dawkins, Executive Director of the Davis-Phinney Foundation, and I am thrilled to welcome Dr. Jori Fleisher to the first in the 7-week series on Care Partner Training. Hi, Dr. Fleisher.
Hi, Polly. It's so great to be with you and just watching the numbers of participants climb as people are logging in. It is so exciting to have everyone here today. Thank you all for joining.
Yes, thank you. Thank you. And thank you to AbbVie, who has provided a really nice grant for us to do this work and continue to do the work that we do and make it available free of charge to all of you who are logging in today. Jori, I'd love to introduce you for folks who might not have had the benefit of watching our conversation last week.
Sure.
So I want to introduce you as a friend of the Davis-Phinney Foundation and a movement disorder neurologist working at Rush Medical Center, Rush University. But aside from that, maybe I could have you introduce yourself and tell folks who you are and why you've really focused a bit of your work on care partners and advanced Parkinson's as well.
Absolutely. So thank you for the kind introduction. So I'm a movement disorder specialist, which means I'm trained as a neurologist and then did extra training for another 2 years in Parkinson's and related movement disorders, and realized as I was going through my fellowship training that I just wasn't seeing people with more advanced Parkinson's, and that there really wasn't a big focus during fellowship training or really during residency on our care partners. They're there, hopefully, most of the time. There's someone seated with the person with Parkinson's in the room, but what am I supposed to be asking them? What resources are we supposed to be offering them? That was really never a big part of training. And it's such a huge need and such a huge missed opportunity. And so I had the privilege of being able to work in this space and go out to people's homes when I was on faculty in New York and then again here in Chicago. And unless we are treating the care partner as equal and as having so many needs, we're really just doing a disservice to our patients and to people living with Parkinson's. So you have to care for the whole.
Is there research before I actually let me do a few housekeeping notes before I dive in and ask you some more questions. Thanks for that introduction and for your passion in this area and caring so deeply about our community and our broad community of people living with Parkinson's and those who care for and love them.
And I should mention, I also have experience with this on the having Parkinson's in the family side as well. So I know this wearing my white coat. I know this on the flip side as well.
As a family member.
As a family member.
So thank you, everybody, for saying hello, telling us where you're from. And I'm going to jump into a little bit of an overview of what our goals of the training over the next 7 weeks are. And then I'm going to get into asking Dr. Fleisher, also known as Jori. I'm going to ask her a bunch of questions as she's the expert and turn it really over to her. So we have brought you here today and for the next 7 weeks, really with the goal to improve your knowledge, your attitudes, and your skills as a care partner for a loved one living with Parkinson's. That terminology, care partner, can be interchanged with caregiver or carer, depending on where you're from and what you like. We at the Davis Phinney Foundation lean towards care partner, and also know that many of you like the terminology care partner and oftentimes switch to talking about caregiver if your person with Parkinson's gets quite advanced. But for most of what we're talking about, we'll be talking care partner, caregiver for the role that you all are playing. And you all may be spouses, you may be sons and daughters of a person with Parkinson's, neighbors, friends. The role of care partner really can extend to a number of people in that who take on that title. We also, another goal of ours is to educate you on the types of care needed to improve your person with Parkinson's quality of life. We will be aiming to teach you the skills you need to help yourself and your person with Parkinson's to live well, and how you can manage change. As we know, this is a constantly changing landscape. We also aim to increase your confidence as a care partner and confidence in your own ability to care for your person with Parkinson's and to make appropriate healthcare decisions and really help you find joy and meaning in your everyday lives. We also hope to increase your connection to other care partners and build a care partner community and increase your self-efficacy and your own resiliency. And then finally, we hope that you'll learn a variety of strategies that you can employ, both physical, to reduce the physical and emotional toll of being a care partner, and as that strain increases on you. Each week, we expect that you'll log into the hub that we just showed you, and look at the materials. If you missed a session, you can go in and watch the recording, and go in and use that hub as your place to find all of the materials that we think would be helpful to you all. You can also jot down answers to questions that we've posed to you, and look at all of the additional resources we've compiled for you. And then if you're comfortable, we expect you to participate in the chat. And our expectation or our commitment to you all is that we will show up, we will answer your questions, we will provide you really important content, and we will respond to you when you have queries to us. Anything, Jori, you think I've missed?
No, I think it's a great summary. I think hopefully people will get a lot out of this, and we're so interested to see what you will do with this, and how this will translate to your own caregiving, how this will translate to the communities that you are a part of already. So keep us posted.
Yes. So to start off, let's participate in the chat. Would you tell us, before we dive into the content today, hello, Dublin, Ireland, wonderful.
Uh-huh.
When you showed up today, and when you're showing up for these next 7 weeks, do you have initially any questions for us before we get started? So feel free to use that chat feature if you have questions for us. Again, we can't see your raised hand. So if you have questions, please jot them down. All right.
Just want to chime in real quick. The password for the hub is care partner, one word. So if you're having trouble getting in there, it's just care partner, one word, and it'll be the same password.
Thank you. For the next 7 weeks, you will hear the voice of our dear Mel Dizon in the background. Sometimes you'll see her face pop on, and please know that she's right here alongside with us, even though you might not see her on screen. That's who that voice from above is. All right. We have a question about preventing burnout. We are going to definitely address that. We have a question. Winthrop Williams mentioned if we had questions, we should reach out to blog@dpf.org. Thank you for highlighting that. We'd really like you to reach out to carepartners@dpf.org. Both will work. It reaches us at the Davis Phinney Foundation. It just helps us sort those emails. So we'll update that. Thank you, Winthrop, for telling us. Allie, no, there is not an expectation that you will become ambassadors after this training. There's an expectation that you will take a survey after the training, before the training and after the training, and tell us what you've learned through the process. And then we hope that you'll stay involved and that you'll feel more resilient, better at doing this role. But we don't have any other expectations. Now, certainly you can become ambassadors. All right. Managing medications while traveling, increased freezing, rigidity, locks at night. What's a conservative approach to adding care, adding meds, stiffness, slowness, drooling? Okay, well, high level of stress, depressed, irritated constantly. Physical limitations are becoming a part of the process. Okay. We've got lots of good questions. How do we keep from being overwhelmed with potential deterioration in the future? Yeah. Yes, these are great questions. We're capturing them. And interesting, somebody says they were shocked at how poorly they did on the self-knowledge test. We also, Jori, do you have any comments on the survey ahead of time?
Yeah, so it's actually a survey that my team and I developed when we were creating an education program for home healthcare professionals. So in my research hat, working on home visits and seeing folks with advanced Parkinson. So yes, we will totally talk about stages. We can talk about advanced. We can talk about dementia for sure. I feel like I could have planted so many of the questions that people are putting in here. So like, bing, 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 bing. We will try and cover all of these things. But we had heard from our care partners that, home health nurses or home health physical therapists might come in, might not really understand Parkinson's. And so we took some of the content that's been woven into this program, but we took some of that content and actually did just a one-day symposium. And we taught home health professionals, and we developed that survey that you took to test their knowledge at beginning and at end of the day. It was just the one day. And we thought they would probably score pretty well. And we were pretty shocked at how poorly home healthcare professionals did, nurses, physical therapists, occupational therapists, speech therapists, who we presume have some knowledge of Parkinson's. But the good news is by the end of the day, they had actually improved really significantly. So those are questions that some of them may seem obvious, and actually the answers may be the opposite. And so hopefully we can poke some holes in some of the many myths and misconceptions that are out there about Parkinson's, all to the end of helping you be an empowered care partner and recognize, wait a minute, I'm seeing this thing. This might actually mean the following, or I know what to do with this situation. So that's the goal of that survey. Do not feel bad if you didn't know an answer. If you knew the answers, feel awesome, but we hope to get everyone doing better by the end.
Great. Super. Wow, so many questions and areas that, as you said, we are going to touch on over the next 7 weeks. I see that there's a comment that Bruce made that's resonating with so many people. And I think that was the comment about, so many comments here. I think that was about, wow, I can't keep up with all of these comments. Well, there was a comment, we'll find it, that Bruce made that was really just everybody seems to be resonating with. And I read it out loud earlier, but I can't find it quite yet. Anyways, we'll come back to that.
I see Bruce wrote, I don't know if it's the same one, how to keep from being overwhelmed with potential deterioration in future.
Yes.
I don't know if that was the one, but I
Yes,
think
that
there
was
was
it.
something to that.
Thank you. Thank you, Beth. And thank you, Jori. Yeah. Is there something we could start off with or refer to one of the sessions that we're going to be diving deep into that topic?
I think maybe two things. I think one is sort of kind of a mindfulness component of just recognizing, I've had someone tell me like stress doesn't exist in the present moment. Stress is either worrying about things that happened in the past that you can't control or worrying about things in the future that you can't control, right?
Mhm.
If you're actually in the moment, it's harder to be stressed, right? You're just sort of grappling with like what is right there in the moment. So some sense of being able, sort of cultivating the ability to kind of be present with your loved one in whatever moment that is. And then something else, which is one of the care partners who I've worked with really closely, and she was part of one of our mentoring programs. And she said that her mentor told her, listen, this is a progressive disease and things are going to get worse. What are you doing to prepare? And the first time I heard her say that, I was like, why would anyone say that to you? That feels really difficult. And it also acknowledges the reality, right? We want to be both optimistic and realistic that Parkinson's is a progressive condition. We can't say what's the time frame that any one person is going to change, but if we are talking about years, right, things are going to change. And if we know things are going to change, then we can prepare. And that should alleviate some of the stress on care partners and the person with Parkinson's rather than adding to it. And I think if we think about it as like, we've got time and we should think about how we use that time the best, right? Whatever that looks like. If COVID taught us nothing else, right? Do the things on your bucket list. Not because there's some finite amount of time. We don't know what's going to happen, right? But if there's a trip that you've been wanting to take, start planning it, right? So how do we plan what we can and be in the moment so we can actually enjoy those things? I think those were two sort of helpful things for me.
Yeah. And the session on Monday that we're going to have, we're going to talk about change and managing change. And then the week after that, we will talk about care partner strain, depression, anxiety, loneliness, isolation. So those will be deep dive topics to look forward to. I'd like to ask folks in the chat, and please know we're capturing your questions and we're going to answer the questions in the session that might be most appropriate. But somebody did ask about the survey, and the survey you would have gotten in an email and from us when you registered. So there was a survey to take when you registered. And if you didn't get that and you'd like to take the survey, we can send it out to you again. And there's the quiz and the survey there in the link in the chat. So for you in the audience, could you tell us, put a few words in the chat, what you think of when I ask you, what does it mean to be a Parkinson's care partner? You put two or three words. What does it mean to be a Parkinson's care partner? Uncertainty, team player, support, structure, supporting, ever changing, rewarding but stressful, doing it all. To walk with, that's beautiful. 24/7 love.
Flexible.
Challenging, committed. To be my best friend to my partner. That just gave me goosebumps. Support, planning for the future, responsibility, surprises, being present, loving unconditionally. Quite a few people say unconditional love. Support. I mean, the words I keep saying, Jori, I don't know if you're saying the same things.
It's beautiful. Yeah.
And hard, as somebody said, sometimes heartbroken.
I also see Larry wrote, fill your own cup first. And I think we'll talk a lot about that, whatever analogy we use for that. And that's part of why I hope people signed up for this, right? This is to help you fill your cup because you can't pour from an empty cup or, put your own oxygen mask on yourself first before helping someone else.
Yeah. Yeah. I see some fear, fluctuating emotions. Eileen said fluctuating emotions, which is what I'm seeing in the chat, right? From fear to bravery, teamwork, patience, stress.
I saw someone
sensitive. Yeah.
Daphne said we've learned that we can be happy and sad at the same time. The holding of multiple emotions is so huge.
Yeah. 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 Sadness, uncertainty, fear. Boy, you all have really, really captured what it's like to be a care partner with a few words. Yeah.
Let's make a word bubble and just be able to, present.
Yeah. Honor, privilege, grief, unpredictable exhaustion. I bet a lot of people understand that. Thank you all. Yeah. Keep humor. Yes. Yeah, a quick question that came in. Can someone sign up for this program within the next week if they have missed a session? Absolutely. This session, they can sign up. The session will be recorded. They can watch this session. And as some of the sessions you might want to miss because you don't think the topic is important to you right now, and you can go back and watch it in the future. We'd love for you to be a part of every single one, but we understand you're also managing a lot in your lives. So
I see someone posted all the changes in the way we live now is so outside of my life expectations or different, dreams that have changed and adapted. And I just want to sort of say we will touch on that in one of the future sessions, this idea of ambiguous loss of this is not how I thought things were going to go. This is not how I thought things were going to look. And that is common and shared. And there's a word, there's a term for that. There's a whole field all about that. So we will touch on that.
Yeah. Ambiguous loss. That's what you
Mm-hmm. Yeah.
And also the topic of this sort of grief and anticipatory grief.
Yeah.
Grief of what you've lost and grief of what's
exactly. And sort of grieving for, truly grieving for, in my mind, I had this, this dream. Retirement was going to look like this. We were going to interact with so and so in this way, and now we can't. Or grieving the loss of the relationship that you used to have with your loved one, even as you still have an important, critical, and maybe different relationship with them now. And those, I think, are things that often I hear from my care partners that they feel like they are alone in that, or that it's not okay to say, I miss the person he or she or they used to be. And that's not, that's normal.
Yeah. Yeah. Somebody mentions missing conversations.
Yeah.
With this person. Yeah. Jori, you've done so much work in this area. Based on your experience, what does it mean to be a care partner?
I don't think I could have summarized it, better than everyone else. I think it's slowing down and living at the speed that your loved one with Parkinson's is at, but also trying to be the researcher, the communicator, the forecaster, the anticipator of what if, what happens when, but what will we do, all of that. I think it's being an advocate and recognizing, my loved one may not be able to state their needs in the following way, or they might not have as much insight into where they're struggling. So who can I reach out to try to get that need met or to try to get the resources that they need? And that's not just I have a phone number and I'm going to call them. That's trying to figure out like what is there a name for for this that we need? Is there a resource that matches this? And then who do I call? So it's so complex, um, and it's just love, right? I mean, it's all whether it's a spouse, whether it's a significant other, whether it's a parent or a neighbor or another family member, it's all love just showing up in different forms.
Yeah.
So
yeah. You in your work and being in the field, if you were in clinic and out in people's homes, what were some of the roles you saw care partners take on at various stages of living with Parkinson's?
I mean, I think people are nurses, right? I mean, from every, physical lifting and moving and adjusting and repositioning and turning and cleaning and toileting, sometimes all of the basic activities of daily living, feeding, right? To therapist for their loved one, being that shoulder that the person, can cry on, being the open ear, right? Being the person to talk them down or to distract or redirect them if the loved one is having a hallucination or is having a delusion where they think something else is going on, right? Being a social worker, trying to figure out, okay, what resources are out there? How do I solve this problem? I think we might need a lift of some kind, or maybe we need a commode, and where do I find that? I am on a daily basis astonished and so impressed and humbled by care partners who come to me and go, did you know about this? Whatever it is, right? So there's something called a lending closet. And no one taught me about a lending closet before I went into medicine, right? This could be at your local, village town hall. This could be associated with a YMCA. This could be associated with a house of worship, but it's literally often a closet or, an old beat up classroom that is filled with donated walkers, wheelchairs, lifts, urinals, right? And if you don't know that it's out there, right, you don't know what you don't know. And so many things, little tips and tricks that I have learned from care partners and hopefully been able to pass them on, right? And it's just people find ways. I think care partners become occupational therapists without maybe recognizing what that means. But to me, an occupational therapist is the troubleshooter. This person is struggling to do this task. How do we get them easily in and out of the car? How do I get them up this step? This step is the one that they're tripping on. How do I, reconfigure the house? How do I change the texture of their favorite food so they can still eat the thing that they want to eat? Right? It's just that daily troubleshooting and wearing all of the hats. So what role do they play? I think they play all of them.
Yeah. Those of you in the chat, what are some of the roles you've taken on that have surprised you or frustrated you or inspired you as a care partner? Feel free to pop message in the chat. Paying the bills, yes. Being a nurse. Personal care attendant is hard. Financial advisor. Motivator without nagging. Boy, we should dive into that one.
Yeah.
Driver.
Complex medication management, 100%.
Organizing all the family events. Yeah. Another medication manager. Cooking. Physical fitness expert. Yes.
I think someone wanted the question repeated.
Yeah.
So what role do you play as a care partner?
Thank you.
Personal trainer? Yes.
Rancher. Sharon mentions helping family members understand what's happening, doing the translation for the family. Managing social interactions. Being his rock. He was always mine. Helping with shower, personal hygiene, incontinence, physical therapist.
I see everything from pharmacist to managing a chainsaw to cut down a fallen tree to clear a driveway.
It's a lot. Yeah, incontinence. There is a session we're going to talk more deeply about incontinence, aren't we, Jori?
I think so.
Yeah.
Getting through to the family of the issues. I think that's so huge. I think so many times there is the primary care partner, and often there may be really, really helpful family and friends around who say, how can I help? Right. And it's really hard to try to put into words, what one thing can you ask of someone, and how do you explain what the day-to-day looks like?
Mm.
And that's if you have family.
Yeah, somebody mentions, Arlene mentioned when their person is in the hospital or rehab, constantly reaching out and asking for care on behalf of the person. When nurses and aides are in short supply, we hear that so often.
Yeah.
And ensuring that meds are given on time. And
I would say most people did great on that question on the survey, which also makes me sad because you know how big of a problem this is. But there's really ample research saying that for our people with Parkinson's, there are medication errors, which are usually missed doses of levodopa and other Parkinson's medicines in at least 75% of people.
mm-hmm.
Right? And it's not because the healthcare system doesn't care. I promise you, being inside the system, even as, not the hospital nurse or anything, it's not that people don't care. It's that they're so unfamiliar with this condition, and they're so unfamiliar with medications that are as time sensitive as our Parkinson's medications can often be.
Yeah.
If someone gets their blood pressure pill at 8 o'clock versus 10 o'clock, not usually a big deal, right? If they take their baby aspirin each day at 4 p.m. or 4 a.m., it doesn't really matter. That's not the case in Parkinson's, right? And that's a really hard thing to try to communicate, especially in this post-COVID time when, healthcare is really still stretched so thin, and there's still staffing shortages pretty much anywhere you go in any setting. There are often nurses scrambling with the very best of intentions to try to get all of the meds to all the people they're taking care of. And they may just have that wiggle room and think, well, an hour or so here or there is not going to make a difference. It is okay to be the squeaky wheel.
Have you had experience watching people be the squeaky wheel and getting what they wanted?
I have. And I think sometimes it's the only way. It can feel really hard. For some people that may come, second nature to them. They're really great advocates just naturally, right? And for other people, they don't want to be a bother, right? It is okay. I'm telling you, be a bother.
Mm-hmm.
If someone gets annoyed by that, you just tell them I told you, and you get someone to blame. You can throw me under the bus, okay? But a movement disorders neurologist said, no, I have to advocate for my loved one to get them as close to on time as possible. And what I will say is there is a caveat that, in case of emergency, right? If someone is having a heart attack in the bed next door, right? Something may trump getting that med on time. If a nurse calls off, right? There's always going to be something. So do you want to be an advocate 24/7 every single moment? Maybe not. Maybe we want to let, some of the smaller things go. But if you're seeing a pattern, please advocate. If your loved one is in a facility for some reason, there are laws that say, even if I send in medication orders and it says, I need you to get these pills at 8, noon, 4, and 8, whatever the time is, right? They have an hour on either side of whatever time I said legally. We can ask nicely You can cajole and beg and befriend and all of those things. Sometimes those are better strategies. But know that, if they come back to you and say, no, no, we've got wiggle room. Legally, technically, they do.
Mm.
Um, but if you can help make the case for, listen, if my loved one has his or her meds on time, they don't have to press the call bell to ask you for help getting up because they're able to move,
Mhm.
right? If they have their meds on time, they can eat their meal fully independently and they don't need your help. But I need your help to make sure that they get their meds when they need it.
Mhm.
Um, Sometimes those can be helpful strategies.
Yeah.
Yes, and I see that. A nurse said that you can ask for a patient advocate to help if no one is getting the meds on time in the hospital. Yep, yep. Ask for patient relations, ask for a patient advocate.
And that's a role in a hospital.
In most places. They may be called something different, but if you use that language, that can usually, if you're, having a hard time, I wouldn't, that's sort of like, you know, there's a mistake on their seat at the grocery store and you try to call the CEO of, Safeway or something. I would, you can ask to talk to a manager. You could ask to talk to, is there a nursing supervisor? Is there a charge nurse to try to help explain? Sometimes it really is just the education of making sure that all of the people who are doing the direct hands-on caregiving and the people above them, right? The bedside nurse may understand that they need to give their meds on time.
Mhm.
But if their charge nurse or supervisor is going, no, you got to do all the following things and we need to have a touch base right at this time. If you can explain to that supervisor, hey, I get it. It's very important, to have the communication. But if my loved one doesn't get their meds on time, here's what's going to happen. And that's going to be more difficult for everyone involved.
Mhm. Thinking about being an advocate for your person, your loved one with Parkinson's. I remember the conversation that you had with Mel this spring, the webinar we did. And you talked about noticing folks who had missed appointments and why folks weren't showing up in clinic. Why were you only seeing people with Parkinson's who were called stage 3, and that was being considered advanced. And one of the things you said, Jori, was the system doesn't know that you've missed appointments or something to that effect. Like, you have to advocate. If you're missing appointments, nobody's going to reach out and say, hey, it's time to reschedule.
Right. There may be some healthcare systems out there, by which I mean, an individual group of hospitals or a practice that has really great information technology in place. I feel like if I miss a dentist appointment, I get an immediate something
Yeah.
from them, right? If you miss a hairdresser appointment, right, I get more communication from a hairstylist than I do from healthcare, right? That's wrong. It shouldn't be like that, right? I will be the first to say our healthcare system is broken in many, many ways. And how do we sort of work within there, right? And so, yes, when we set out to try to reach people who are homebound, trying to figure out who are they? Who's out there? Who have we lost to follow up is actually so difficult.
Mm.
There's no, in your electronic medical record, whether your doc is on a system that uses Epic or Cerner, all these different systems, number one, they don't talk to each other. So if you tell one doctor something, and this happens every day in clinic with me, someone will say, oh, yeah, so-and-so said something, but you can see their notes. Guys, I hate to break it to you. Most of the time, I can't see their notes. I can't. So some systems talk with each other a bit, but what I can see from healthcare system A, B, or C, even within the city of Chicago where I am, is different for every healthcare system. And sometimes I can't see any of that until the person checks in for their visit with me that day. So as someone who tries to figure out what's going on with my people, and I will look ahead at the chart the night before for the people I'm going to see the next day, I can't see what's going on at other hospitals. If you have imaging, so this happens all the time. Something happens, someone gets an x-ray or someone gets an MRI, right? And they'll say, hey, they'll send me a message, hey, I got an MRI. Can you take a look at the picture, see what you think? if it's not within my healthcare system, I might be able to see the report from another system, but I cannot see the actual pictures myself. And most neurologists worth their salt, we want to see the pictures. A picture is truly worth 1,000 words, especially when it comes to brain imaging. So, I can't see those pictures, and the system to get them is ridiculous. We might as well be like faxing or passing back, stone tablets, because you have to tell the one healthcare system, here's the information, and I give you permission to share this with this other healthcare system. And sometimes the other healthcare system has to say, hello, I have permission from the person to receive the following information from you. And you have to sign both of those two different forms, and they have to reach each other before anyone will release anything. That's so broken.
Mm-hmm.
It's so broken. So I spent time during my residency training as a neurologist in Botswana. It is a country in sub-Saharan Africa. At the time I was there, 2.1 million people. There was one neurologist in the public sector. That's it for 2.1 million people. We have way more than that in the US, even though sometimes I know for movement specialists, I saw the comment, it might not feel like that, right? But the healthcare system there at that time, the way that people kept their medical records, everyone had a folder.
Mm-hmm.
You had your own folder. And if you came into the hospital, your folder sat on your table and I wrote notes as I was seeing you. And then that folder went home with you and it lives with the patient. So anything that had happened, whoever was seeing you at that moment had access to. And it's very analog and very paper. But actually, that was a little bit more straightforward than the system that we have here. So all of that is to say, please don't get frustrated with your healthcare providers who want that information and want to know everything that's gone on. But if someone tells you, I don't have that, I can't see that information, they're not trying to put extra hurdles in front of you. The system is very piecemeal still. So for some people, a simple way to go is trying to keep your healthcare all within one system. But if you've got established relationships and your primary is over here and hospital systems change, it can be really difficult.
Yeah. And what would you recommend to our care partners who are navigating this? We're saying, be an advocate, be the squeaky wheel with your healthcare providers. And if you're in a hospital, are there any other tips that you've seen care partners use to get what they need for their person?
I think keeping a binder, and that can look different for everyone, but I have people that will come in and they've got a binder and sort of, a laminated front page that says, my primary care doc is, here's the name, here's the number. My neurologist is, my cardiologist, whoever it is that you see, my physical therapist is, right? And those can change, right? So sometimes it's one of those like plastic pockets and you can update that file. If it's a Word file, you just update it when something changes. Having the medication list that you can bring, the most updated medication list to whoever you are seeing, right? If you're getting imaging or, a procedure or something in any place, if you can get that report, and you may be able to download that report off of an electronic medical portal, right? My chart or whatever it is that you use to access or send messages back and forth. If it's a procedure, put that in there. If you have a hospitalization and you've got discharge instructions, the person came in on this day, here's what we thought was the problem, here are the tests that we did, we sent them out on the following medicines. Keep that in the binder, right? And eventually, the binder can be a really great place to have advanced directives. So if your loved one has a healthcare power of attorney, have a copy of the healthcare power of attorney form in there. So this is one of those other things that doesn't translate from one healthcare system to another. So you might tell the primary care doc, listen, I am my loved one's healthcare power of attorney. In the event that they can't make a decision for themselves, I'm the person to call. That may only mean that the primary care doctor now has that knowledge, but no one else around them does, right? And no other healthcare system does. So have that, give a copy to whoever you see and say, can you scan this into your system? and give me back the copy or bring them a copy, right? If you have a living will, here's what I want. Here's what I do not want, right? Under no circumstances should you do the following, or absolutely please, right? If you have that, and I encourage everyone to have advanced directives, right? We never know what's going to happen. I have one, my husband has one, right? Have that, keep that in the binder. And having a copy of those documents, adult kids may want a copy, having a copy that lives at home, things like that. But I think that can help you keep everything together. Mm-hmm. And maybe you have a paper in there that says, in anticipation of my next visit with my movement neurologist, here are a couple of questions.
Yeah.
I love when people bring questions in. I can't answer 10 questions in a 30-minute session because I have questions that I need to ask you too. And I want to see how you're moving and, takes time to answer. But keep that running log of questions.
Mm-hmm. Yeah, we have worksheets that the Davis Phinney Foundation has created. And one of those worksheets is how to prepare you for your next doctor's visit. And so you can download that and use that in your binder. And use
I'll attest to that. I have people bring that one in.